It is Tuesday, August 4th. Welcome to our COVID-19 Task Force update. This is our 115th episode. On today's program, Arnold Lazare will tell you a bit about some of the directives and some of the attention that it's gathering. We took many calls here at the office today from the various media outlets. He'll tell you why that's happened. And Lisa Westaway will be here a little bit later on. She's got plenty to report on, including some information about visiting the hospital to visit your loved ones. So stay with us and enjoy the program. Arnold?
Good afternoon. Today I'd like to begin by once again announcing that the public service announcement went out last night, informing pretty much the community that the bars and gaming venues would be not opening on August 10th. The rationale for that was that back when the 10th was picked as a date, we mentioned that it was always tentative and that we would rely on the health and science of the situation to decide if we were going to move forward. Given what's happening around us, specifically a spike in 3-digit numbers of infections, given the occurrences in the other countries, the task force did not feel comfortable at this point moving ahead. So we've made the decision not to reopen the bars and gaming venues on August 10th. And that's been met with mostly support. All of the comments that we've heard today indicate that it was anticipated, which tells us that people are watching what's going on around us. And a lot of people are comfortable with the fact that the task force has made the decision and are supporting it. As a result, we received many requests from outside media asking about just that directive. And once again, we highlighted the fact that Kahnawake took affirmative action early on, 3 weeks before the province. And we decided to shut down the community, and we highlighted the fact that there's been not many positive cases, there's been no hospitalizations, and there's been no deaths. So that's something that the community can be very proud of because it shows that they've supported the directives. And the feedback from the outside media, of course, they asked the opinion, what do we think of other jurisdictions? We told them that's their prerogative, so we are confident in our decision to delay. No date has been set yet, but the task force will be assessing in the future. Once again, we know by the science of it that it's a 3-week turnaround. Something will happen on Monday, and Quebec increased their numbers to 250. Probably in 3 weeks we'll see what the consequences are, if any, and more than likely a decision will be made at that time. We did say we would make the appropriate decision, either to stay the course, to open up more, or in the worst case scenario we would have to close down a bit. So once again, the task force is monitoring all that, and we will be closely watching what goes on. As a result of the PSA, there was a comment about the schools, like we're not opening the gaming and bars to protect the drinkers and gamblers. We're not opening because we want to protect them, and that's one way that we can protect it. There is some science behind opening the schools, and I'm going to ask Lisa to address the rationale or the importance for opening the schools, and the Education Center is working on a plan to make sure that happens in a good way. Last but not least, the task force has been receiving multiple requests about testing and testing issues. We would like to remind people that the most appropriate place to get those answers is at the KMHC hospital. So if people have any questions about testing, there's regulations. We would strongly recommend that they don't contact the task force and contact the hospital directly. With that, we'd like to have people to stay safe, and if the task force phone lines are manned, and of course there's email. So we will be reconsidering in terms of upcoming directives. We will be reconsidering the XO bus service that's scheduled to begin on next Monday, the 10th. There's once again no rationale not to allow that, and we've received requests from the gyms to look at that situation. That is also being assessed. So in the meantime, good job, Kahnawake. Keep up the good work, and have a good afternoon. Yawa.
Good afternoon. So I wanted to give a little bit more information about the school reopenings and some of the comments that we've seen on Facebook Live. Your comments are important to us because they allow us to get a good pulse of what's happening in the community, what people are feeling, what some of the fears are. And what we're seeing is there is a lot of fear about going back to school, and that's very understandable because there hasn't been a lot of information that's come out regarding plans for return to school. It doesn't mean that people aren't working hard on these plans. They are, and as you know, they'll be presented on Thursday by Robin Delaronde. However, we can certainly understand the fear, so we wanted to give a little bit more information today about the plans to return to school and the relationship with the directive to not move forward with the opening of bars and gaming. So as Arnold mentioned, bars and gaming, there are elements of success actually in school reopenings, and we see this in the research. I was actually just thinking that it would be important. We can create a section on the KMHC website which would bring you to some of this important research that we use in making our decisions, and it will also be provided to you by the Education Centre. But there are many elements that are important in looking at when we reopen schools, and they are very similar to the measures that we looked at in business reopening. So we're kind of moving forward in the same way that we did with the business reopening, in a very controlled, structured way. And the measures that are most important to look at in ensuring adaptations within the school environment are hygiene measures, social distancing, and the ability to do contact tracing. So adapting the environment so that you can maintain those measures, the same that we follow on in our day-to-day lives, that we have to be able to adapt them into our day-to-day school environment. And so those are the plans that the Education Centre is working hard on. They're looking at what was the regular process in school before, what is going to be the new process so that we can maintain these measures. And when we look at the research, schools that were able to implement these measures, along with a very important fact. So the last fact to look at is the environment that the schools are reopening in. So we look at our community. So many of the schools, if we look at the research, we don't have a lot because we've just coming out of a summer break. Some of the schools that opened prior to the break opened during the pandemic phase. So when we were in really high community transmission in many different areas, and we did see outbreaks. We saw outbreaks in some Montreal schools that you may recall, and that the media and the news is very quick to point out now that schools have the possibility of reopening in the future in September. So those schools reopened during the pandemic phase where there was community transmission, and therefore much more difficult to control the environment within the school. And in the studies that they did, there's still a lot of uncertainty about the outbreaks in the school, where they transpired from. Did they actually come from the community, or were they exacerbated by the reopening of schools? And it's still, the research is still unclear in terms of where those outbreaks started. So one element that we see in the research that is key, besides the hygiene, the social distancing, the ability to do contact tracing, is the community transmission. Within our community right now, we are in a very good position to reopen schools because we do not have any active cases. So we actually have, if we're able to implement those measures within the school, that coupled with the fact that we have no active cases in the community, provides us with a very positive environment in making a decision to move forward. The other elements that we look at in school reopenings are what are the detrimental impacts to children should we decide to remain closed. As you recall, we looked at the person as a whole for business reopening. We looked at psychosocial impacts. We looked at health impacts, all health impacts, in fact. And so I spoke about these last week, but I wanted to mention them again, the importance or the impacts to children should we decide to remain closed. And there are some very significant impacts to not receiving instruction in school, especially for the younger kids. So some of the impacts are just regarding education as a whole. They're not being in school, and the length of time that someone is not in school, a child is not in school, can lead to severe learning loss. And it also leads to increase in behavioral needs. And we know that there are long breaks from in-person schooling can also be detrimental to student learning. And the teachers have consistently reported this after summer break, where there's what they call a summer slide, so where children's actual past learning has to be repeated. And so the longer the schools remain closed, again, that leads to more detrimental loss of learning. Schools also have a big role to play in social and emotional skill development. So it's not just academic, and the longer the schools are closed or that children are not in school, there are impacts to their social and emotional skill development. And having this stable environment fosters that growth. We also know that being in school provides access for many children to mental health services, social services, speech therapy, and other important services that people or children do not have access to when they're not in school. This is important as well, especially for people with disabilities. And so these important services, we don't, again, our children have not had access to these services while being out of school, or it's been very limited. There are safety issues involved. We've spoken about that. There are some children who by being in school, this is a safe environment for them, and is protective, not just for their safety, but for their nutritional needs as well. And there are some children who rely on being in school in order to have their nutritional needs met. And lastly, physical activity is promoted within the school environment, and access to opportunities for physical activity more so than when children are at home, and that's what we see in the research. So there are many, these are some important reasons why that we've looked at in order for the promotion of return to school. But despite all of those reasons, it all comes down to the basic element that the task force has continuously spoken about and used as a reason to move forward, and that's health. And we're moving forward with the reopening of schools as of today, because we always look at what's happening in the weeks to come. But as of today, in looking at what's happening around us and looking at the safety measures that we can implement in the schools, we feel confident in reopening the schools, and we feel confident in the measures that will be implemented and that will be presented to you next week. It doesn't mean that everything is figured out. There are many, many details that I think are important to the teachers that still need to be resolved. And from what I understand, principals have been having many meetings throughout the summer with their staff to be able to hear and listen to the preoccupations of the teachers. And I believe that those answers will be provided shortly to teachers. But they are still being worked on. And so I just wanted to provide that, that information so that it can maybe help you feel a little bit better with the fact that we're moving forward. We know that this is going to be difficult, and in fact we expect it to be even more difficult than the reopening of business on June 1st. And if you can recall, that was a very difficult time for the community, and we expect very similar response in the community for the reopening of schools, because it is scary, and we do understand that. And so we hope that coupled with the education center and the plans that they're preparing. And again, they've been working hard on these plans in order to put these safety measures in place. The education center has the responsibility to develop the plans for their schools, and the task force and Dr. Gauthier will validate the health information, so the health measures that are implemented to ensure the safety of both staff and children. That is the main goal, is to ensure that the employees, the teachers, and we care about the teachers. These are the people that are educating and bringing all of this instruction and social skills to our children. Their health is very important, and your children's health is very important. Once we open, we'll be following what happens as we move forward in the same way that we did for business reopening. The important aspect is to be continuously following the impacts of the reopening, the amount of possible cases, so that we know when it's time to pull back, when to revert to different type of instruction, because health is always the most important, both for employees and for children and for our community as a whole, because whatever happens within the schools will be translated to the health of our community. So it's very important that we look at all of those aspects together. So the goal today is just to reassure you that we're looking at these elements very seriously, and Robin will be here on Thursday to present more details about the actual reopening plan. I wanted to talk a little bit about visitation. So as you know, or you may not have heard, but we have started as of yesterday visits to inpatient on the inpatient floor, so no longer downstairs and outpatient, but family members and loved ones are actually going into their loved one's room and are able to sit beside the bed. And of course, there's physical contact, touching hands in the same way that we had in the visitation before. We have up to 20 people per day, 6 days a week. A few less, maybe not quite 20 on Saturday, but still the visits are planned 6 days a week. And I believe all families have been contacted to arrange the first visit. So we wanted to give you a little bit of information about the safety measures that we have implemented, so that you can see that we've taken all safety precautions in mind in planning these visits. And we thought it might be helpful for you to see what you can expect when you come to KMHC to visit your loved ones. So we're going to show you a video that will give you a better idea of what to expect. Thank you to everyone involved in producing that video, and I hope it was helpful to you in helping you prepare for the visits. So I have a bit more information about visitation. On the weekend, as you know, we had a drop-off, which on Sunday or Saturday, I believe, and we have a drop-off every 2 weeks. But what was special about the drop-off this past weekend was the first time that we allowed people to bring in ordered food or homemade foods, and so I just wanted to thank you for that. That was a very big success. We had residents who received their cornbread and steak. We had people who received who received vegetables from the garden, and there was even a birthday cake that was delivered. So this was our residents were thrilled in having received this type of food, which is really different from what has been done in the past. So we're going to maintain this. So every 2 weeks at the drop-off, you can bring in food, and we ask that that be the location for your drop-offs. So I know some people, when they've come in for visits to the floor, they've brought in items for their loved ones. We ask that you do not bring any items in when you come for your visits, because we're unable to disinfect the items properly, and it poses a risk. And that's why we have these drop-off days available to you to be able to drop items off for your loved ones. So when you come in for your visits, just come yourself and share your love, but not any gifts on the visits. The other request that we have is that, or actually what we want to let you know of, is that we cannot accommodate last-minute requests for change of visitation. So if somebody can't come at the last minute, we're unable to replace that person with someone else. So we have very strict measures in place. Before visits, we contact each person. We do a screening for COVID-related symptoms. Our security has the list of people who are coming in. Our staff have the list of people who are coming in. You may not see it behind the scenes, but it's quite a scheduling and organization process. And so by changing people last minute, it has a great impact on all of our processes from A to Z. So we're sorry that we cannot accommodate last minute changes, but if we have 24-hour notice, then we usually can accommodate. So we ask that you let us know in advance if you are unable to make your visit and you want to change for someone else. And I guess the last thing to mention, as you know, we've contacted everybody to arrange for these first visits. But as of now, the responsibility lies on you should you wish to visit. And so if it's you or a family member or a best friend, anybody who wants to visit somebody at KMHC can contact 450-638-3930. That's our regular hospital number, and it's extension 2270. And if you call us, we will schedule an appointment for you. Right now, we have many people who want to visit, and we're trying to make it fair for all the residents so that everybody has someone to visit with them. And so it can be that if many people call for the same resident, we may put you on a wait list just to ensure that we have equality across the board, and then we call you back and we schedule you. And so again, we're scheduling 20 people a day, so that's significantly more people than what we had visiting prior. So we think that this is going to continue to be a positive experience for all of those visiting. One last thing about visitation, at 6 o'clock tonight for inpatient families, we have our second Zoom meeting. This first meeting was very important. It provided us some really good information about what's important to you as families. We also had spoken with each of our residents to know what was important to them, and with that information we were able to implement significant changes in our visitation procedures, and so it's a great opportunity to be able to express yourselves. So we urge you to be present. I know that you've all received a letter in the mail with instructions on how to sign up. You also received a phone call at some point today to ask if you would be participating, so I thank you in advance for your participation, and we're really happy to hear what you have to say. So I just want to, maybe as a last thought, go back to education for a moment, because we did receive some questions on the task force site, or the Kahnawake 911 site. Just to mention that those questions are great questions. They're very specific, and they will be presented on Thursday in the presentation by Robin Delaronde, who is the ED for the Education Center and is working with her staff in preparing the plan. And those questions will be provided at a later, the answers to those questions will be provided at a later date. So thank you again, and I hope this helped you with some of your fears, and we'll be seeing you again on Thursday.
Thank you very much, Lisa, and lots of information in there, and thank you for that. Just like to finish up with something Arnold was talking about in terms of the delay for the gaming establishments and the bars. He mentioned that that the proposed date is not going to happen. He also did not say, though, that if there is another date in mind. Right now it is indefinite. We're going to play things, play it by ear, and just watch what's happening around the world, as we have been doing. And as the task force has been very diligent. As a matter of fact, if you watch the news tonight, the reason why I think we had so much attention from the media around us is because Kahnawake is doing things a little differently based on the needs of our community. So with that, I'd like to say thank you so much for taking time to be with us this afternoon. We wish you all the best, and we shall see you on Thursday. Take care, Kahnawake, and everyone else. Niao koa dano, onigiwahi.